treat this thing? Well, typically this thing doesn't go away. Once you have the mechanical injury, that annular tear, it doesn't go back in. You can do physical therapy, you can do chiropractic. Maybe my colleagues in chiropractic can talk more about that. But as far as I know, from a spine and spine surgery standpoint, herniated discs don't repair themselves. And so we would try alternative modalities. We would try steroid injections. We would do chiropractic physical therapy, sure. But most often, patients would end up on the operating table for a procedure. Now, the traditional procedure is an open back surgery. You make a long incision, and you take out the joints, and then you put in basically artificial joints in the form of screws and rods. So I did some of these surgeries with Dr. Deuk. Dr. Deuk, he is the best at this, and I just saw like the precise details that made him the best at this. It's little things like asking the patient if they're on fish oil or turmeric, blood thinners, right? Why did he want to know if the patient was on blood thinner? And it was bleeding control in the operating room. So patients, if you control their bleeding in the operating room, you'll have less blood that escapes. So one, you'll lose less blood, but two, you'll have less muscle damage. Dr. Deuk was an expert at preserving the muscle and being super careful with it. Dr. Deuk understood how important the muscle is to the human body. And you don't want to go in and butcher the muscle because the patient will have terrible pain and terrible recovery afterwards. You want to be very careful with the muscle. You want to make sure the patient doesn't bleed into their muscle because their recovery will be worse. However, Dr. Deuk's flagship operation was the Deuk laser disc repair. This is where he would go in with basically a pen-sized instrument, and he would go into the level of injury. So we'll bring back the level of injury here. He would go into here with the straw-shaped instrument, and he would laser off this disc herniation, relieving the impingement on the nerve and providing patient essentially immediate pain relief. It was quite miraculous. I would see the patients right after the Deuk laser disc repair get up and tell me their pain was gone. I would see them the next day in the clinic for a follow-up, and they'd be walking around with no pain in their neck, in their arms, in their legs, wherever the disc herniation was, wherever we repaired it, that pain was gone. It was incredible. And the recovery time was essentially like then, right? There was no big scar. The incision was like literally this small. Dr. Deuk's a wizard and will go in with it through a pen and fix people like that. Patients will then be in a brace, just like you would be in a brace after a big open back surgery. But the reason for the brace here is because you need that tear to heal. Now, while Dr. Deuk removed the herniation, that tear is still there. My theory always was, can we use regenerative medicines to help heal it? Well, I'm thinking at BPC 157, maybe stem cells, PRP. He doesn't do those. I would think also like collagen, peptides, really focusing on getting the nutrients into the diet to speed that healing. But typically, the healing process was about 6 months. So patients would be in a brace, they do their physical therapy, and they do the chiropractic, all safely done, all monitored in their clinic. And patients had really great outcomes with this. You know, unless they like picked up something super heavy and they re-herniated, the patients had no pain afterwards. So what are the alternatives